So if we talk about a waiting period hiyo 10 months na mtu ako expectant what if something comes up that is not related to pregnancy, then he force early delivery. Can give you an example. Maybe someone has a low blood pressure, either low or high. Then hii condition ikuwe advisable to like do an early delivery or terminate the pregnancy.
Yes.
Hiyo inaweza lipwa. Hi everyone, I hope this video finds you well. My name is Martin, in case you're here for the first time. Na sisi ni watu wa insurance. We do civic education as well as reviews on insurance, especially within the Kenyan market. Now today we want to have a very interesting conversation on medical covers, and more specifically we want to talk about maternity options because it's one of those questions that really keeps coming up. I think mimi simalizagi kama wiki moja kama sijaulizwa mambo ya maternity.
Okay.
Mtu ananiambia, by the way, I had a client alikuwa ananiambia my wife is pregnant and I want to have a cover for them. Alikuwa anasema hata sio ya kitambo sana. Tulirealize like 2 weeks ago we are expecting a baby. Okay. So ananiambia, hebu niambie nini maternity cover sababu nataka kwanza kuwasavia. So we want to have that conversation. Normally maybe just to break it, maternity maybe you are going to expound more, but inakuwa na some conditions. Waiting period ya 10 months and then you can't take a cover when you are pregnant. So how do you do those mathematics? Unaweza chukua ndio uitumie ama how can you time?
Okay.
So I know you are there, you are watching, and probably you have someone who maybe they really need a medical cover, but to serve for maternity ama delivery, lakini of course washa deliver, washa conceive. So let's see what is in this maternity option covers.
Yes. So thank you, Martin, and I want us to have this conversation, which is very important. What we usually say is you can never take a medical cover that you already know you will use it. That is not to say that you should not take it.
So unataka kusema ni equivalent ya hawezi chukua cover ya gari ukiwa ushapata accident.
It's very similar.
So hapa hivi ushapata accident.
Unaona sasa hii maneno ama uone gari yako imeanza kuleta mashida. So unajua ile kitu hapa nitafanya lazima ni fix insurance. So you cannot take medical cover when you know you are sick or when you know you are almost delivering. So what usually happens is you are allowed to have the medical cover. And the medical cover, because when you talk of maternity, you cannot take it as a standalone. That is, you exclude inpatient, outpatient, then you say, I just want a maternity. You are not allowed to do that. When you want to have a maternity cover, you can only do so when you have taken the primary cover, being inpatient. Also, you cannot take a maternity cover if you only have inpatient only. You must also add what you call outpatient, so that you are allowed to now enjoy the benefit of a bigger limit of maternity. So you cannot take up a maternity cover because you already know that you're almost there and you want to have an excellent delivery. So the only thing is that that maternity clause allows you to enjoy the benefit after 10 months. That means that before you take up the cover, you must be without no sign of
it's very good that you have mentioned that. Kunakuwa na hiyo ati huwezi tumia hiyo cover until 10 months. So the 11th month unaweza tumia. So could I be right kusema if I do my timings vizuri the 11th month na hiyo 12th month nikiweza jitime vizuri naweza itumia?
Yeah, you can if you are able to do that, which is it's not easy. It's not easy, but if you are able to do that, you can enjoy that particular service.
Yes. So talking about conditions zenye huwa zinatreatiwa na maternity covers, ni conditions related to delivery.
Absolutely.
Sindio? So if we talk about a waiting period hiyo 10 months, na mtu ako expectant, what if something comes up that is not related to pregnancy, then it was like delivery. Can give you an example. Maybe someone has a low blood pressure, either low or high. Then hii condition ikuwe advisable to like do an early delivery or terminate the pregnancy.
Yes.
Hiyo inaweza lipwa. Would it be termed as a maternity whatever?
No. Okay, what we do is that any medical cover, as much as it has its own conditions, especially now that we are talking of maternity, what we've exclusively said is, if at all you have a medical cover and you're expectant, it will not cover you in the first 10 months. But at the same time, insurance looks at the cost. Yeah, you could be pregnant or you could be expecting a child. Unfortunately, something has come up. Could even be an accident. And you know, when something like that happens, sometimes the recommendation of a doctor is we need to have this child delivered prematurely. So as long as it has nothing to do with maternity itself, you are allowed to access the medical benefit to the full limit. Yeah, and the beauty is, apart from now the maternity, there is basically a lot of other illnesses that exempts you from those waiting periods. Yeah, for example, if a condition is accidental, yeah, because you could have a serious issue, yeah, that affects that unborn child, and as I've said, the doctor recommends possibly, I don't know what we call it,
premature
delivery.
Yes.
Yeah. Also, you could find that you have a dental, yes, issue that requires surgery, and it will affect the child, because you know an unborn child is very sensitive. Sometimes there are those things that the medical cover allows you to access the benefit even if you are expectant. Yeah.
All right. So tumesema kama unaweza fanya timing yako vizuri, yes, kuna hiyo waiting period, lakini ukifanya hesabu yako vizuri, hiyo the 11th month ama 12th month mtoto akuje, it's okay.
Yeah.
Utalipiwa. But in case you notice that you are pregnant, don't even bother to like think that you can enjoy maternity option. Ni ukweli tu. Ni black and white.
Black and white.
And I hope we have been able to give you value for your time.
Yeah.
And in case uko na swali, hata kama sio medical, whether it's general covers, whether it's investment, pensions, anything touching on insurance, we are looking for those questions in the comment section. We react to your videos, we give you content based on the questions that you are sending to us. And thank you very much for watching this video to the end. Make sure that you like this video, share, subscribe if you haven't. It's the best way to support our content. And I hope to see you in the next one. Until then, God bless you and
Bye.
bye.